everyone. We're going to move to a closing time. Cue, what's his name? Leonard Cohen. So it's my real pleasure to introduce someone who most of you know very well. Natasha is here. Natasha is the executive director of CACAPUD.
Making me feel like a movie star up here.
And I'm really pleased that Natasha's agreed to do a closing speech, and then we've got a little thing we'll do after Natasha's finished, and then we'll wrap up for the day. Okay, Natasha, thank you.
Yeah, so I don't know if everybody knows fully about our organization, but we are an organization that is people who use drugs, fully board and staff, and we try to empower people, and that's looking at the regulated market, looking for decriminalization, as well as making sure in the meantime that there's safe supply available. So I guess when we're thinking about everything that went on today, we have to circle back and really think about the people that we're talking about. There's an absence of a lot of people who use drugs speaking here. I think that others may have noticed that, and you know, we need to do better, right? We need to have those people in the room. Thanks. But beyond that, we are the real experts, right, when it comes to our lives. We know what we need. We need service providers and practitioners. Oh, sorry, it's not close enough. Oh, to listen to us when we walk into the room. And I was saying earlier, I wanted to do this exercise. Who in here has used drugs? Please stand up. All right. How many people aren't? Now, does that include also cannabis, alcohol, tobacco? Those are all regulated drugs as well. So I think we have a pretty good standing room in here to show that if you look around, if everybody looks around to see how many people are standing around them, we're not that far apart. We're really actually the same. It's the laws and prohibition that separates us. And so, yeah, I think today there was a lot of good sessions, and I think that we've brought it to a good close in my mind. I know that there's going to be, I believe, was Rebecca supposed to be doing something with is this it here? Is that what's going on now? The drawing? No, that was for the panel. Okay. Yeah, so anyway, I was glad to be here. Got to see some of my great friends I've met in other places. But no, truly, when I think about it, our whole foundation is built off of nothing about us without us. And, there was a lot, the medical system has really nothing to do with us at all. We feel shunned and blocked from it. And we all have to strive better. Another thing is we have the power in society to change that. And that means by voting, right? Like, we need to get out and vote for the right party to make sure that we're standing up for the human rights of people who use drugs. Without it, we're going to see so many more thousands of people die. And I guess I'll leave it at this. There's been 3 days of conference that have gone by so far, and that means that over 63 people have died since we sat here and talked about it. And that's going to continue until we all get together and make a change. So I'm keeping it short and sweet. I thought there was some other thing going to happen, but I guess I'm wrong. Are you? Yeah. I was like, where's she going? I'm not really
Sorry, I thought you were going to talk a bit more. Sorry about that, everybody. Okay, yeah, what we wanted to do was just get some feedback from you all about how today was. So here's one just to warm us up. Let's just get Alex on the Jamboard. 1 second. Please wait for this.
Yeah, I was so confused. I was like, what? Where is Rebecca? I thought we were doing something else.
Here we go. Okay, so Alex and maybe Robin Alex and Robin here are going to write down some of the things that we say. So, okay, today, one word to describe today. Shout it out. Inspired. Connection. Motivating. Community, nice. Emboldened. Radical. Innovation. Learning.
Yeah.
Solidarity. Yeah,
I was too
nice.
close that time.
It's great to be in a room with people who you know are your people.
Yeah.
Yeah.
Yeah, I mean, I've never seen one of these actually work in person, so I'm paying attention to that as you're speaking.
Yeah. It's pretty good.
Yeah.
We were like, let's get a whiteboard. Too much work. Yeah, amazing. Jamboard by Google. Okay, what surprised you today? What surprised you? Lack of drug users. Okay. Oh, a room full of them. I was just saying. A lack of drug users speaking. Okay.
Yeah.
I was surprised to find other people also are struggling about working within the medicalized model.
Struggling. Others struggling within the medicalized model. Yeah.
And do you mean, sorry if you don't mind me asking, do you mean clients or actually the prescribers struggling?
I'm not, well, I can't speak for the prescribers, but for those of us that are trying to do the harm reduction community social piece, it's challenging. It's challenging to exclude people. It's challenging to say no to people. It's challenging to understand the clinical considerations that our prescribers have with the different kind of training.
Yeah, we need a lot of good harm reduction docs in Canada. There's few and far between, unfortunately, but I think the more gatherings we have like this, and the more we learn from each other. And so I don't mean to cut in, Rebecca, but I think also it's not just always having harm reductionists in the room. It's also having opposers in the room. And not people that are going to be like really shitty and mean to us, but how do we get out to the larger population if we aren't inviting those people into our space to learn about harm reduction, to understand why it's important, to understand how it can save somebody's life? And I think that's lacking in a lot of conferences that I've gone to in my lifetime. And so I think that's another takeaway for me, is that we need to not only have more drug users present and speaking, but also having opposers. Because the only way we're going to change their minds is if they come and figure it out, right?
I just want to stop seeing all my friends stacking this talk
Yes.
drug crap. And if I stigmatized, offended anybody, I apologize in advance or afterwards, to be honest. But, that's the case. I'm just here to end this thing.
Being honest should never be being mean to anybody if you're being honest and telling your truth.
You're right.
Yes, because we've lost thousands and thousands of people. Yeah, and
Crime with their lives.
yeah,
That's me, I love people.
I share your grief.
Anyways, yeah, we all know the grief or we wouldn't be here. Like it doesn't discriminate, it doesn't care. It's like and it's getting as bad as it is now. There's worse shit coming down the pipeline. Guys,
Yeah.
and like we gotta get ahead of that shit. Now's our chance. Or if we don't, then
Yeah.
no one.
That actually goes to my next question for people. Some people called out inspiring, motivated, those kinds of things. And the next question is, what are you feeling motivated to do next? What are you leaving with today? And what are you feeling motivated to do next? Where are you going to go with this? More evidence?
Sorry, I didn't mean to make that little noise, but there's a lot of evidence. But
Oh, publish more
Yeah.
evidence. Sorry.
you know how I look at it? If we've lost 26,000 people, How much evidence more do we have to prove? We know they're dying from our poison drug supply, and the only way we're going to fix it is if we have a response, and you can't respond to something that isn't regulated. And so it's like if I went to a grocery store and lettuce had listeria on it, they'd pull it all off the shelf. There'd be warnings out about it. So, I hear what you're saying. Evidence is great, but when you're in a crisis of this magnitude that hasn't been treated like we've seen how COVID changed things, we've seen how fast laws can change. Why is it that we don't matter? See? And I don't think it is the evidence. I think it's the view. It's got to do with legality and illegality. You know, it's prohibition. And let's face it, like the war on drugs was never a war on drugs. You can't put drugs in jail and harm drugs. You harm us. And so there has to be, this is just my opinion, and I don't mean to, I'm not disagreeing with you, because evidence is absolutely, we do need evidence. But at the same time, when you're in a crisis situation, if you compare it to COVID, there wasn't a lot of evidence. It was something new. Nobody ever heard of it before, and everybody came together and made a solution. And so why is it that we can't do it for the drug-using population?
Okay, educate and support potential prescribers. Yeah, people breaking.
And there's not meeting the needs, and the mortality rate is going up, and the hospitalization rate is going up. Like, you got 20-year-old kids that look like they're 80. Like, and this is like from this like you know, like the novel benzodiazepines, duoflomazepam, and it's like duoalprazolam. You know, like xylazine, the next thing to come down.
Yeah.
It's like people start losing limbs and this and that. And like,
Yeah, I agree with that. But, you know, our organization strives to, we think it's very important to go work with service providers or physicians, especially in med school. We work with Dalhousie University in Halifax, Nova Scotia through their global health program. And we have 2 student meds come with us for a year, every year. We also do it with the nurses, the College of Nurses. We've done it with the College of Pharmacies. We also have talking prescription monitoring, which is, you know, the tracking of prescriptions in Nova Scotia. I know other provinces have different names for it. And just actually working with the doctors in the community. But we really have been putting an emphasis on targeting students now, because it seems like you can't teach an old dog new tricks. Maybe you can. I don't know. It's a lot harder, though. So when you get them younger and you have them in the clinic and they see people for who they are, it's a lot easier than just seeing the medical side of it, but also seeing, like my organization is of people who use drugs that work 9 to 5, do policy work with Health Canada on a regular basis. It is, for me, I'm very proud of our relationship with Health Canada and all the work that we've done. We worked our asses off to get here, but we're also drug users, and so you know, we feel it's our duty to keep this fight up. We shouldn't have to, because we're people too, but you know, it's an ongoing battle that I don't know, well, I wish would end soon, but I don't know if it's going to end soon enough, because, as I said, even as we sit here now, there's somebody probably dying, or if not, dead.
Drug checking technologies.
Well, you can't have a medical intervention. Like, he found he was on a benzo thing, or like went to shit for a while and tried to get off benzos and was having grand mal seizures. Like, it's not becoming ridiculous to do maintenance. You don't know. That's where medical people can come in, is to be medically intervened. How the fuck do you know? You just found out xylazine is off your drug screen, so it's probably everywhere, you don't know. And then I think instead of like the pressure that's on medical side, when I'm watching like doctors are going down, one of the prescribers are going to apply is just the amounts are incredible. Like, it's
Yeah, and those are very good points, and thank you. That was very poignant. You know, I think we saw that with cannabis regulation. The ethical drug sellers that were out there at the time providing that service, all of a sudden weren't allowed to be in that market, a market that they had run because the government was too cowardly, in my opinion, to be able to turn over the law quick enough, right? And it's the same now. Yeah. Yeah. Very correct. Yeah. Yeah. Yeah, thank you guys for your remarks. I really appreciate it. Maybe we could have a conversation a little bit further. I don't know if you guys are attached to CACAPUD. We'd love to have you join our membership. Yeah, no,
Let's do it.
yeah. Good point.
So in terms of like motivated to do next, looking at that, the different models and like the Fantora, the drug testing, yeah.
Well, I mean, it's fiscally irresponsible for governments to keep on going with drug prohibition in itself. Look at how much money, what has it done? More poisonous drugs, more deaths. And I always used to say this when I'd end a speech, but I'm still going to sit here if there's more questions afterwards. But you know, what Einstein's definition of insanity is doing the same thing over and over again and expecting a different result. And that's what we continue to do. And we are wasting taxpayers' money. So if there's any other way to talk to government that makes sense to them is to talk about the dollars and cents, because when they see the dollars and cents being able to stay within where other markets or budgets or wherever they need it, yeah, and it's an unfortunate thing that hasn't been taken into consideration, because in my opinion personally, the law enforcement has too much power, and so do the RCMP, and so even when Health Canada believes they're doing the right thing or trying to do the right thing, I think they feel pressure from them. That's just my opinion, though.
We also basically call it bullshit. I will stop because I raised my rants in your practice, but I can go on for a while. But like we were talking about on the way here, the ludicrousy and I guess pressure that's put on prescribers, which is awesome. Just having half during COVID, I couldn't see my family doctor, but the only way prescribers like were counted is if they did all these fucking magical things that always been part of like getting housed, all of this like stuff that's never paid attention to. They have to do to be allowed to do this to save a life, because that's the only thing that matters. Like that's nobody else got fucking primary health care during COVID. Like it was all restricted, but these poor fuckers had to do it on top of deal with COVID and this scary like it's just like a lot of.
I'm hearing a lot of appreciation for the prescribers who are the.
I could be biased, like, but like the first thing we came down here and the doctor took a chance on me, but my mom jumped in, but for fuck's sakes, like we're being asked to do that in the world war.
And compared to your average homeless person struggling with addiction who might use drugs, anyway, I'm sorry if I worded it wrong, but you know, like the doctor has a lot more to lose, whether you say it or not. Like, what do they have to lose for me? Like, you know, you're gonna try to fine me? I don't pay my debts, especially not the government ones. If you got no money in your name, I'll pay my debts. But you know what I mean? But
He's going long.
you know what I mean?
Thanks, Steve.
And
Oh, no, go ahead.
I guess I know we're getting really close to time. We've got like 6 minutes left, I think, to end the session. But I'm a firm believer of when physicians and and nurse practitioners and nurses, and they go in and they take an oath to do no harm. I would say you are doing a lot of harm if you allow somebody to walk out of your office when you know that their only option is something that is going to kill them. So.
Yeah, thanks. So, one of the things, I didn't intend to do this plug, but I'm going to, because I am hearing about feeling inspired and motivated and such. And so I'm going to just do a little plug about our working groups. So we've got a few working groups that are starting up over the next couple of weeks and a few that are already operating. Program operations meetings happen once a month on the third Friday of every month. So if you're starting a new program or looking at starting a program and you want to talk to other people involved in program operations, so like coming up with models and policies and figuring out the day-to-day flow and things like that, that's a good spot to go. We also have a working group that we're starting on access to pharmaceuticals. So if you're interested in helping help figure out how to navigate that and put some pieces together for that, that would be another great working group. We're also looking at putting together some recommendations for clinical guidance to support different aspects of safer supply, such as carries and what was the other? There's a few. Withdrawal management and pain management. So that's another area that might be of interest. And rural and remote models is another group we're looking at. Rural and remote communities, models for rural and remote communities. Yeah, so if you're feeling inspired and motivated and wanting to be involved in more innovation and things, think about those working groups.
Could I say one more thing?
Yeah, of course.
I would encourage everybody here to look up our website at capud.ca, CAPUD. If you're thinking of how to work with people who use drugs or have them brought into program, we have See Us, Hear Us, Respect Us, recognizing the expertise of people who use drugs. We also have our Safe Supply document, concept document that was written in 2019 on our website. We also have another document for people who use drugs to learn how to be in the room on policy discussions. And so there's lots of stuff there that if you're unsure, most certainly I advocate for you to look it up, take a read, and if you have a question, our number is on our website too. Just give me a call, because I mean, what we really want to do is make sure that people who use drugs are seen as everyday people, because we are. And we just want to stop being shunned out of society and overlooked, because we're making efforts, so we need others to make effort. There is pay in there as well.
Yep.
There is standards of pay in our document.
Great. All right. So a couple of last-minute housekeeping things. We will be sending you a survey. We'd love to have your feedback. Today has been our first of hopefully what will be many more meetings like this. And so, yeah, we'd love the opportunity to learn what was good, what was great, what wasn't so good, and what we really got to do differently. So, yeah, all of that. And then also, if you're parking, make sure you see the registration desk for your parking ticket, discount ticket thingy, validation thingy.
I just wanted to thank all of you who put it on today.
Thank you. I have to tell you, what an amazing team of people, from our organizing committee to I really want to do a big shout out to our community support and, our community safety and conference support team. Amazing people who've been working really hard on that. I'm really grateful to the LHC team who brought all the supplies today. Oh God, this is why they write this list, right? But you caught me off guard. But yeah, so many people who've done such a great job. The Alliance for really providing a lot of logistical support, and CACAPUD and the membership there for being involved. And yeah, it's been a great day, and I'm really grateful for all of you being here. We will be putting the recordings of the videos up on our website in a few weeks. I think it'll take a couple of weeks or so. I'm not entirely sure on the timeline there. And then also you've got the QR code, which has some resources and things like that. So we'll put as much as we can up on there so you can share the information. And if anybody has any questions or thoughts, we're here.
Yep.
Yeah. Okay. Thank you all. Thank you all for coming today. Yeah.